Hello everyone, welcome to my channel. Today we have another OBGYN question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 30-year-old woman gravida 1 para 0 at 30 weeks gestation comes to the labor and delivery unit because of regular painful contractions that began 5 hours ago. About an hour before arrival, she experienced a sudden gush of clear fluid followed by continuous leakage. Earlier in pregnancy, a detailed fetal ultrasound demonstrated bilateral renal agenesis, and the patient elected to continue the pregnancy after counseling. Her temperature is 36.9, 98.4 Fahrenheit, blood pressure is 116 over 72, pulse is 90 per minute, and respiratory rate is 16 per minute. A sterile speculum examination confirms rupture of membrane with clear fluid pulling the vaginal vault. Beside ultrasonography shows severe oligohydramnios, a fetus in frank breech presentation. What is the most appropriate next step in management? So first things first, we gotta understand what's the issue with the baby. So it seems like we are having a delivery, but the baby has bilateral renal agenesis. And if the baby has bilateral renal agenesis, we can't really have the baby because the baby is gonna die and it's not gonna survive. And with that being said, let's go over the answer choices. A. Proceed with expectant management and allow labor to continue. Well, this could work. That would be vaginal delivery. And let's read the other questions because the method of delivery is also important. B. Perform an emergency cesarean delivery. Well, cesarean delivery puts some risks on the mother, right? And vaginal delivery is usually safer for the mother. No, the point is that the baby is upside down, and that's what frank breech position mean. And with that, you couldn't really have vaginal delivery because the kid would die. But the thing is, in this case, the kid is gonna die anyways. So A could work because yes, in normal situations we wouldn't allow vaginal delivery, but hey, the kid is not gonna survive anyways. So A could work. B, I would say it puts too much risk on the mother. C, administer antenatal corticosteroids. Well, we use this if there is a risk of delivery before 37 weeks of gestation. In that case, we use this, but right now there is no point in protecting the baby. D, attempt intrauterine saline infusion followed by tocolytic therapy. Well, this we know we don't need to do all these for the baby because baby is not going to survive. But in normal situations, if the baby is going to survive, because we are dealing with a severe oligohydramnios situation, we might need to do this. But right now, the kid is not going to survive, so all these attempts are not going to be helpful. E, begin intravenous magnesium sulfate. We do intravenous magnesium sulfate if you are dealing with delivery before 32 weeks of gestation, and we usually do it for the fetal neuroprotection. But in this case, as I've mentioned before, that is not an issue. With that being said, A is the correct answer choice. If you like this video, please don't forget to like and subscribe. Thank you very much.